This week we're going to be discussing orthopedic tests to help diagnose disc herniations of the low back, lumbar radiculopathy, and pinched nerves in the lower extremity. We're going to start it off with what's called the slump test. So for the slump test, patient will be sitting down with the knees against the edge of the table. First step is we're going to round the mid-back. Chin will tuck all the way into the chest. And if he, for example, is having problems on the right side, from here, we'll extend the knee to lockout, and then for our final step, we'll dorsiflex the ankle. So if this reproduces signs and symptoms, it'll aim us at a proper diagnosis. The other thing we'll do is at that point, if we reproduce signs and symptoms, we'll lift the non-symptomatic leg, and if this changes anything, makes things better or worse, we'll understand if there's what's called an upward or sliding dysfunction. So this is the slump test. Our next test is the straight leg raise. So this really will help diagnose nerve impingements, lumbar radiculopathy, and disc herniations. If there's any problems on the right side of the body, for example, we're going to lift the right leg. Very important that the knee stays straight, and we're going to slowly lift until we provoke the signs and symptoms or he starts to feel a stretch in the back of the leg. If we do provoke signs and symptoms, we can help differentiate it with ankle dorsiflexion. So this typically would make things worse or bring on the signs and symptoms even more. And then if I let off, it'll typically feel better here. Now it is a normal reaction is just feeling a stretch, whether it's in the back of the knee or behind the thigh. So that is much different than feeling that sharp sensation in the back or shooting down the leg. So this is the straight leg raise. All right, this next test is a neurodynamic test for the tibial nerve. So if you watched our nerve palpation videos we did in our last series, the tibial nerve, remember, it runs on the inside of the calf and it innervates the inside of the foot and also the sole of the foot. So if there's any problems in this area, this tibial test can help detect if there's a problem there. So what we need to do is we need to dorsiflex the foot, evert it, so we're moving this way, and also dorsiflex the toes. And we're going to do this all before we start lifting the leg up. So again, dorsiflex the ankle, eversion, dorsiflex the toes, knees straight again, and we're going to go very, very slow until we provoke signs and symptoms. And if we do, typically dropping back down will make the patient feel better. So this is a neurodynamic test of the tibial nerve. Next, we're going to discuss a neurodynamic test to test the sural nerve. So remember, with our last videos, the sural nerve will innervate mainly the lateral components of the calf and also the lateral aspect of the ankle. So if the patient comes in with problems here, this is a nice test to help differentiate things. So what we're going to do for this one is we will dorsiflex ankle and invert it this time. And holding that position, we will then slowly lift that straight leg. And again, if we provoke signs and symptoms, a good way to differentiate it is just bringing it down. If it feels better, we could potentially have an impingement of that sural nerve. Our last neurodynamic test is testing the fibular nerve. So remember, the fibular nerve, it's a branch of the sciatic nerve. It runs around the neck of the fibula, closer on the lateral component of the calf, and it's really innervating a lot of the top of the foot or ankle region. So in order to stretch this area, we're going to now plantar flex the ankle, plantar flex the toes or flex the toes, and invert the ankle. So once we maintain that position, knee straight again, we're going to slowly raise here, and if signs and symptoms get provoked, and they feel a little bit better as we go down a little bit, you may be dealing with a fibular nerve impingement.